Do you want to talk about the largest section of the op report? Well, let's take a look. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. The procedure note is the largest section of the operative report. This is where you can find a lot of good information to assist in coding correctly. The physician or surgeon usually provides specifics on what they did in the procedure or surgery. This is the section where the surgeon provides the detail of the surgery. You should find information related to a lot of things, such as the approach, the position of the patient, the depth, if there are wounds, the anatomic site of the surgery, and any findings from the surgery. The tricky part here is that sometimes physicians don't always specify or document the approach. However, as a coder, you should be able to look for certain keywords. Remember, keywords are important that would identify what the approach is. There are several procedures in the CPT book that are identified by their approach, such as open or closed or even laparoscopic. It is in the coder's best interest to make sure that they read the operative report. They should never assume an approach based on the title of the procedure or the diagnosis for the procedure. They really should check and verify in the operative report what the physician actually did. This is the absolute best way to ensure accuracy. Now, if there are complications or any abnormal findings, the physician should also document this in the op report. Another item that should be documented in this section is if there are any extenuating circumstances, such as an extended time for the surgery or situations that may require additional work. Other information that you can find in the procedure note would include if there's blood loss, if there were tubes that were placed for draining or feeding, any hardware that was used as part of a repair, if there were excisions, lesions, foreign bodies, biopsies, and grafts. The additional items in the procedure note really depend on the actual procedure that is performed. Another bit of information that you can find in the procedure note that may or may not require additional coding is the type of closure and or any extensive repair. So remember, it is the coder's responsibility to make sure that they are correctly assigning the codes for any surgical procedure. And one way to ensure that you are coding correctly is to make sure you read the various parts of the operative report. If you find that there is missing information, then you make sure that you query the physician to get the information that you need. Now, there's one more thing I want to talk about in relation to the operative report, so make sure you tune in next week to find out what that is. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder, reminding you to be safe, be kind, and don't wish for it, work for it. If you are not part of our community, click the subscribe button and bell for notifications when we upload new content. And make sure you check out some of these videos on the side. We have a lot of information that may be of interest to you. Until next time, take care.